Chemotherapy is a chemical drug given to patients to either completely get rid of cancer, ease the pain, or make it smaller. The three ways chemo can be given are through a vein, injected through a body cavity, or in the form of a pill. Chemotherapy is used more often than other cancer medicines, such as radiation, because it not only destroys the fast-developing cells at the cancer site, but also the ones who have ventured off into the body. Unfortunately, there are downsides to chemo, like side effects that include hair loss, low white blood cell count, nausea, and fatigue. Some doctors claim that after so many years of having chemo, it can cause chemo brain. Chemo brain causes people to forget things, inability to concentrate, or even difficulty retrieving words. Chemo may also put stress on your family, and it costs lots of money. Chemotherapy, a drug given to help cancer patients, has both positive and negative effects on families and patients, and has decreased the death rate in many cancer patients. As for if chemotherapy truly does get rid of cancer, it is a matter of opinion. Like most cancer patients say, it is hard to single out whether chemo truly cured their cancer after everything they went through to try to get rid of it.
Okay, I'll watch it.
When were you diagnosed with cancer and what type?
Okay, my first diagnosis was in July of 1997, and it was invasive ductal breast cancer.
What was your reaction to the doctor saying that you had cancer?
My first reaction was you're kind of in a state of almost disbelief, like you're hearing it, but they're not talking to you, or they're saying things, but it isn't real. So it's kind of almost a denial, but more just a shock, like not me, you know, that kind of thing.
How did the doctor tell you you had cancer?
I had a mammogram, and they said it was very suspicious. And later I learned it was a classic breast cancer mammogram, but at the time they just were kind of a little bit more evasive than that, and they wanted to read it, and then they wanted me to have a biopsy the following week, so I made an appointment for a biopsy, and so it wasn't a final diagnosis until after the biopsy. And the day after I had the biopsy, which was just the following week, the doctor called me and said yes, it was malignant, and he wanted me to see a surgeon right away, and we caught it in time, and he was very, very positive, so he kind of downplayed the cancer, which, once again, you hear it. I was going through the motions, but I still didn't really register with me.
How did your family respond?
Kind of the same way. I mean, everybody's kind of, oh, wow, you know, what can we do? What's our next step? Where are we going to go? You know, and my husband was very supportive and said, you know, let's go, let's get this done. We'll get to the doctor on this date. We'll do this. He was just very organized mentally and kind of a really good, strong support. How he was actually feeling, I don't know, but he was very strong otherwise.
What type of chemo did you receive?
The exact drugs were, it's called the AC treatment, which is erythromycin, big long word, and Cytoxin, and that's the C, and then erythromycin is still used a lot with treatment. That was 15 years ago, and it's sometimes called the Red Devil.
How did you receive the chemo?
I had intravenous in my arm, and it took about an hour, hour and a half, something like that, at the chemo center down at Methodist, and it was once every 2 weeks, and I had 4 treatments.
For how long did you receive chemotherapy?
Yeah, it was 4 weeks I had the chemo, and then after the chemotherapy I had a month of radiation every day, actually 5 weeks of radiation.
Did you have any effects with chemotherapy?
Yeah, I had the normal side effects, which was hair loss, eyebrows, eyelashes, just basically all your body hair, your arms, everything, and just kind of everything just goes, and it starts about 2 weeks afterwards. And I did not have I didn't have anything else, so to speak, just basically the hair loss, and that was about it, physically.
Did you take anything to prevent side effects?
Yes, I did. I took a pill. It was a nausea pill, and took it right the day I took chemo, and I think it worked pretty well because I was never really nauseated. Tired, and not hungry, but not nauseated.
What do you think the worst part of your chemotherapy session was?
The worst part of the whole thing? I think my biggest reaction was when I was just sitting, getting the chemotherapy, and the red, it's erythromycin is red, and so it's bright red, and you can see the red, and it's going into your vein. And then the nurse said to me, she said, make sure you don't let any of that get on your arm, because it'll really eat away your skin. And my brain was going, you're putting it in my body, and you're worried about it getting on my skin. You know, it was just so unreal that something that toxic, you know, was going inside me. And that was probably my biggest reaction to the whole chemo, was the actual injection.
Do you think the chemo affected your family?
I kind of interchange cancer versus chemo because I think it's a whole package. They're reacting to the cancer. The chemo was kind of a small part, the chemotherapy a very small part of cancer, and it starts and it finishes, but the cancer starts and then it may finish, but you're always aware that you had cancer or that your body is susceptible to cancer or something like that, even though you kind of put the chemotherapy out of your mind.
What were the expenses of chemotherapy?
I can't give you a real honest quote because it was 15 years ago, and I know it was a lot, but I know my daughter's chemotherapy, which was just in the last 2.5 years, was her therapy alone, the chemicals were over, her treatments were over $100,000. And that was in about 3 months, so that was quite a bit.
Did chemo help get rid of your cancer?
Yes, I don't know. You don't know if it works. The only thing you can do is assume it works and assume that it got all the cells it was supposed to. I did have a reoccurrence 10 years later, and my cancer cells were what they call the slow-growing 10-year cancer cells, and so I don't know. I don't know where that one cell came from, or if it was a new cell that was activated by something totally different. But it was in the same breast and the same spot, and everything was just the same. Only it was even smaller than my first little tumor. So yes, it helped, but yes, I did get it back. So.
Do you think chemo changed your life?
Once again, I'm gonna exchange cancer for chemo for cancer, because cancer does change your life. It makes you aware of your own mortality. You think that you see everybody else getting cancer, but you think, you just don't think about yourself being in that situation. But once it happens to you, it can happen again. And I've learned, it can happen to members of your family. And I basically think it changes your life in a positive way. You start to see things in a more short span, like what's important today, the little things. You don't look down the road, put your future boots on, and think, what's going to happen to me in 2 or 3 years. You forget to enjoy the day, or you forget to enjoy the ride of life if you're thinking way down in the future. So yes, I think it changed. It made me more aware of just everyday life and what's important.
Are you in recovery or remission from cancer, and if so, for how long?
The second time around, I'm 4.5 years, and I'll call it recovery or remission. Either one is the same. And as far as I know, I'm cancer-free, and that's the way you kind of have to accept it, unless you deal with another bout down the road. So yeah, I'm in a good place right now.
Thank you.
You're welcome.